Test, test. Good afternoon. Welcome, everyone. Students, it's good to see you all dressed up and looking especially spiffy today. Got your white coats, lots of family and friends in the group as well. I'm Kirsten Bodden. I am the program director for the PA program, so I'm very excited to welcome you all today and really impress on you the importance of friends and family in your role in the journey of our students, right? Your support to them is crucial. So we're really glad that you could be here today to celebrate with us and with your students. So students, today's white coat ceremony marks a special occasion for you in your journey to becoming a PA or a physician assistant. I mean, PA is a little bit less of a mouthful, and it signifies your entrance into the medical profession. We're here today to emphasize the compassion, collaboration, and excellence in providing care to patients. And rather than waiting until graduation to recite the oath, you will do so today. Our hope is that this serves to underscore the values that are embraced at the core of healthcare and to serve as a reminder of the importance of science, but also humanism. As you near the clinical phase of training, you will further expand your knowledge and skills and do so in the settings of clinics and hospitals alongside patients and their families. It is a tremendous honor and privilege to participate in their care, and we are confident that your professionalism and empathy will shine. You may have already noticed that time in the program flies by. We know you've put in a lot of hard work already, and we're excited to share with you in this rite of passage with you today and with your loved ones. In this spirit, the Gold Foundation provides us with Keeping Healthcare Human lapel pins, and the pins serve as a visual reminder that you'll be able to add to your white coats in order, they're a reminder that to deliver the best care to patients, compassion and empathy must be hallmarks in your clinical practice. And each of you will receive a lapel pin at a later time. We don't have those for you today, but you will get them, and we hope that you'll add them to your white coats. Okay? All right, congratulations on beginning your career, and please join me in welcoming Dr. Betty Copeland, who will share some of the historical context of the white coat.
I gotta hold the mic and read this. No, that's okay. That would be even more awkward if you held it for me. Okay, just for those in the audience, I'm a PhD doctor, not a physician. But I am a physician assistant, yeah. Okay. So welcome everyone, friends and family. Did you think PA school was gonna be this hard? Yes? Friends and family did? I have to say, that as a PA faculty member, so working full-time with 4 kids, although I will admit my husband takes care of our children, 4 kids, and getting my PhD was not as hard as PA school. It is tough stuff, PA school. So congratulations on making it this far. It's my privilege to tell you a little bit about the white coat ceremony, what it is. And as Dr. Bonin sort of mentioned, this ceremony marks the transition into a health profession. So it offers the recognition that someone has officially become a member of a healthcare profession, still a novice, but entrusted to do the things necessary to learn to become a PA. So in the first year, this includes a lot of book work, but also learning the skills necessary to provide patient care. And in your second year, it's in the clinic and with the opportunity to touch patients, which is a big responsibility. So the white coat ceremony actually is about 3 decades old, so not that old. It was started in 1993 by Columbia University's College of Physicians and Surgeons, and it's now widely performed in health professions programs in the US and around the world. Generally, at the ceremony, people discuss what it means to be entering a profession and discuss that profession's values. Let me see where I am here. So values of the PA profession include holding the health, safety, welfare, and dignity of all human beings as one's primary responsibility and treating all those who seek care equally. Now, some have criticized the white coat as a representation of elitism or a separation from others, including patients. And I see those arguments. I almost never wear a white coat, and my patients call me Betty, although the students call me Dr. Copeland. They won't after graduation. They'll call me Betty. That said, the white coat can, in fact, be a powerful symbol for patients, like the title that you will have. It is a symbol of your expertise and the potential to help people in a time of need. And while it is a powerful symbol, it should not be a symbol of power or of privilege in an elitist sense, but of the privilege of simply being able to care for people who, in any other settings, may be strangers. So for those not familiar with medical culture, a short white coat, which you all will have, is worn by students or health professionals in training, although some full-fledged providers choose to wear short white coats as a symbol that they're always students, always committed to learning, or because the short white coat is more comfortable. Long white coats show that someone has completed all the requirements necessary for their profession. So in my case, wearing the white coat reflects that I'll be speaking at a white coat ceremony. I do have all the credentials of a fully fledged PA, though, long white coat. However, this doesn't mean that I don't value the white coat as a symbol of a healthcare professional. So I'm going to share a few instances when I was reminded of what it means to be a healthcare provider, and these are my versions of the white coat. So the kindness that my first preceptor showed me, Tim, who the students know I talk about, when I was an extremely nervous student, worried that I didn't know enough to take on the responsibilities of a PA. I didn't, but he assured me that I would learn. My preceptor, who after we saw a patient who was angry and pretty unkind, did not complain, but said, "You know, she is always so nice. She must really be in a lot of pain." The physician who took the time to express how deeply sorry he was that there was nothing more he could do for my dying father. And the PA who told me, when my little infant daughter was hospitalized with pneumonia, that I wasn't expected to be a healthcare provider, but allowed just to be a mother. And that infant is about to go to law school. And I still remember how much relief that comment brought me. So the challenges of our current healthcare system are substantial. And some days choosing to be a PA will seem like a career or a job choice. You will study a lot and you will go to work and you will complain, particularly during the studying part. But some days you will know you've made a life choice that truly impacts people's lives. So as you start your path, continue your path toward becoming a PA, look for your versions of the white coat. And as you learn about and begin to see patients, strive to embody it, whether you are wearing one or not. Congratulations. All right, and with that, I'm going to introduce Dr. Jacob Gubler.
Oh, you don't need a clap for me, but thank you. I appreciate it. Good evening, students, family, friends, guests, staff, and faculty. For guests who do not know me, I am Jacob Gubler. I am a certified PA and have been since 2011. I'm currently serving as the director of the postgraduate fellowship program within the department. And I have, or prior to joining NAU faculty in 2018, I practiced clinically for 7 years at Gila River Healthcare on the Gila River Indian community. And that experience has deeply shaped my clinical practice and who I am as a PA, as an individual. It is a privilege now to work alongside such talented and dedicated educators, your faculty, and We share a unified vision to mentor and prepare the next generation of PAs who will go on to expand healthcare access across Arizona, especially to patients and communities that have been historically under-resourced. Class of 2026, it is an honor to be speaking with you tonight as we observe this milestone in your education. As you continue your journey toward becoming compassionate, competent medical providers, and in 3 short months, you will transition from didactic learners to clinical students. And there is so much to celebrate. Already you have amassed a tremendous amount of medical knowledge, completing rigorous coursework, dedicating hours to labs and case-based discussions, refining physical exam techniques, and sitting for countless exams. Alongside that, you've developed critical professional and interpersonal skills that will shape how you engage with patients, collaborate with peers, and carry yourselves into clinic. You owe yourselves and your classmates a round of applause, and we, your faculty, join in celebrating your accomplishments. Now, you know, as we all do, there is still much to learn. You've already come to understand that PAs are essential in every discipline of medicine. We examine, diagnose, treat, prescribe, and most importantly, we listen. We help people heal, and as PAs, you've committed yourselves not only to providing care, but to becoming lifelong learners in a field that constantly evolves. The PA profession was born from a need. In the 1960s, Dr. Eugene Stead Jr. recognized a critical shortage of primary care physicians, and with a bold vision and the support of colleagues and medical educators, graduated the first class of PAs in 1967 from Duke University. 68 years later, here you are, answering the same call in a new era with new challenges and opportunities. As you prepare to enter the clinical phase of training, I want to ask you to take a moment of reflection. Why? Why have you chosen to become a PA? What drives you to step into exam rooms, to advocate for patients, and to keep learning? Your why will be your anchor on the long days and difficult cases. It will remind you of your purpose. And just as important, how? How do you want to show up in the profession? How do you want your patients, your colleagues, and the communities that you will serve to experience your care? The how is more than just clinical skill. It's about humility, empathy, curiosity, and integrity. It's about how you treat your team and how you treat yourself. It's about bringing your full humanity into the room every single day. So as we celebrate what you've accomplished, don't lose sight of what lies ahead and who you are becoming. The didactic year has trained your mind, and the clinical year will stretch your heart and test your resolve. As you walk into this next chapter, carry your why and your how with you. They will help you to become not just a PA, but to become the PA your patients need the most. I want to share with you a writing from a former second-year PA student. As he was nearing graduation, he was asked to share something he learned from rotations with the first-year class as they were about to start their clinical year, just as you all will be doing very, very shortly. After his palliative care rotation, he wrote this: "I'm more scared now, having come so far in rotations. I know at times I can be cynical in my own mind about things called emotions, though who isn't? But that's not what I'm scared of. Prior to rotations, I was scared of becoming jaded and hardened. Should I now be scared that I won't? Let me explain. I learned actually I care about people and families and feel a small fragment of their devastation by looking into pained and saddened eyes. I'm still haunted by the edematous face of one patient with neck and throat cancer. The lymph drainage from his head had long been occluded by the invasive cancer that was literally slowly strangling him. With saliva running freely down his puffed and cracked lips, he could only communicate by writing on paper that was haphazardly attached to a clipboard. He wrote in broken grammar about how he wished he had not chosen a life-extending surgery a year prior. Each letter he scribed pierced into my heart. He was in pain. He could not speak, and he could not breathe. Blood clots were continually blocking his tracheostomy tube. He finally made the decision to leave the hospital on palliative services and return home to spend his last few days with his wife and family. His wife had just been called in by the doctor, who told her they needed to discuss his care. Pathology reports from the biopsy earlier that day had confirmed the worsening of his condition. She thought they were going to discuss further treatment options or possibly another surgery. She did not know he had made the decision to die. She was introduced to me, the PA student, before the doctor started in with the serious matter at hand. The room was quiet when the doctor spoke to her. Her husband silently sobbed with quiet tears falling from his cheeks. He wants to go home, where he can spend his last days with those who love him, the doctor said. The sound that came out of the wife's mouth was more chilling than anything I'd heard before, yet it was subtle. It was the sound of a breaking heart. Her tears were not shed alone. My eyes welled as she wrapped her arms around my neck and held me tightly. As a student, I was not prepared for this moment. My arms encircled her. We wept. "I'm so sorry," were the only words I could manage. I then watched her lovingly interact with her husband, wiping his mouth and kissing him. They held each other for a long time. I saw love, true love. My eyes welled more. My throat felt dry and tense. I didn't understand why I was feeling this. This was just one patient, one day, in one rotation. I had never previously met this person and his wife, so why was I feeling so strongly for them? By the time we left the room, things were calm. Somehow, after the burst of grievance, everything felt right. The patient's decision for him was right. His wife's support was right. The mood was right. My emotional reaction, it was right. I don't think there is any great way to stop having emotional responses to patient situations. I can see how many providers become calloused. Is it odd to fear that I won't? I hope I do not, but it scares me. It scares me to feel the hurt of patients and their families, but I felt something better than fear after the experience. I had the sensation that I was intact and my emotions were right, and I was ready. We are not immune from tears as students, and we shouldn't be. We should embrace them. What you just heard was written 14 years ago during my own clinical training. I was that PA student. I share it with you now because that experience, like so many of the ones you're about to face, left a mark on who I am as a provider. It taught me something I hope you'll carry with you. That what you bring into the room, your presence, your compassion, your humanity, is just as vital as the clinical knowledge you've worked so hard to develop. Empathy is not a liability. And now I've lost my place. It is one of your greatest tools. In the months ahead, you'll witness pain, healing, hope, and heartbreak. Some moments will shake you. Others will shape you. You may question whether you're ready, whether you're strong enough to carry what your patients will share with you. But that is part of becoming a PA. Don't resist those emotions, embrace them. Let me remind you of why you chose this path and what kind of provider you want to become. The clinical year will teach you how to care for others, and it will teach you how to stay whole, stay human, and stay connected to what matters most, the people you serve. Thank you.
Thank you. Thank you, Dr. Gubler. We will now proceed to the presentation of the white coats. So, everyone's going to mobilize. Give us a moment. Are you okay with holding it? Is that okay? I don't know why this one's locked. Yeah.
I'm reading. Yeah, I'm ready. How many fit up there? Okay, are we ready? It's probably as. There we go. It's better. Okay. I want to say congratulations. You guys have done awesome. Okay. Nafisa Abiola. Juan Aceves. Jacqueline Amaya. Alex Barta. Alina Bastian. Sierra Beck. Jackson Brousseau. Emily Burrows. Ramon Bustos. Madison Calabretta. Riley Collins. Edith De La Torre. Stacy Dina. Hannah Epstein. Michaela Etzity. Sonia Fatahi. Bailey Fowler. Anna Fredenberg. Chloe Galello. Alexandria Garcia. Devin Garcia. Yaritza Garcia Elias. Jennifer Garnica. No. Samantha Geist. Emma Giordano Walther. Faith Gonzalez. Victoria Guzman Grass. Andrea Hickman. Jesse Higgins. Dr. Cook, I see why you wanted to switch right then. Michael Huber. Monica Huber. Da Ju. Valerie Lerma. Samuel Lopez. Alejandro Lopez. Julie Ann Mavis. Danielle Munoz. Mirna Munoz Garcia. Mary Wynn. Clyde Nina. Macy Noble. Hector Ortiz. Angel Edgardo Para Lopez. Logan Peary. Jenna Puglisi. Sahara Rahman. Hallie Razzo. Abraham Sanchez. Lexi Schwan. Maria Schwindeman. Zachary Smith. Fallon Sonnen. Bridget Sutter. Lily Ann Mabel Thurlow. Alia Tuajin. Giovanni Villarreal. Jamie Williams. Hasib Zafari. Sergio Cevada.
Once again, congratulations to all of you. And thank you to Professor Goodman for pronouncing and announcing all of your names, and to Professor Cook and Professor Harrison for coding, and all of our other faculty who are not directly participating in the ceremony today, but certainly have participated and will continue to participate in your journey. So next, we will now have Julie Mavis, the class president, come and lead the class in the PA profession oath.
Thank you, Dr. Bonin. Before we get started, I just wanted to thank everyone for being here tonight and sharing this special night with us. I will now ask the class of 2026 to all rise and recite the oath with me line by line. As I don this white coat, I solemnly pledge to uphold the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will provide effective, evidence-based patient care with empathy, honoring my role as part of the patient's healthcare team and the professional relationships that support their well-being. I will strive to uplift my community through the thoughtful application of my knowledge and experience. I will foster growth by sharing and expanding the collective expertise of our profession. I will embrace this opportunity to be of service to others with appreciation for those who have guided and empowered me. I will always carry with me a deep sense of gratitude for the journey that brought me here and all that lies ahead. And taking this oath, I commit to living these values, finding purpose in healing, and leaving the practice of medicine better than I found it. Thank you.
Thank you. You can be seated. Well, I'm Rick Dean. I'm the founding director of the NAUPA program, and I have the honor of giving the closing remarks. As our time together this evening comes to a close, I realize that I'm the only thing that's keeping you from the refreshments. So, that said, I'd like to thank all of our guests for attending and witnessing this white coat ceremony, a solemn testimony to a career of service to others by the NAUPA class of 2026. 12 years ago in the same auditorium, the inaugural NAUPA class of 2014 received their white coats and recited their oath. Subsequent classes of NAU students have done the same. And in addition to talking the talk, they've also walked the walk. As 74% of NAUPA graduates from the classes of 2014 through 2023 practice in Arizona. 63% practice in a health professional shortage area or a medically underserved area. These numbers are far higher than for graduates of the typical PA program. Your NAU predecessors have walked a noble path of service to others, a path that we hope you will follow. As you move from the classroom to supervised clinical practice at your upcoming clinical rotations, opportunities to be of service to others will be all around you. As illustrated many times tonight, this ceremony marks a point in your education where an important transition occurs, where your knowledge of medicine guides your decisions, but your human interactions with your patients, healthcare team, your community, and your profession will determine how effectively you serve others. Everyone, thank you all for joining us this evening to witness this important event. Please join us for those aforementioned refreshments and to celebrate this important transition with our students and your friends and family. Also, a photographer will hang around to take pictures of your groupings and families if you so desire. Thank you very much.